Dr. Chris Koeven here with Time to Adjust Family Chiropractic. Wanted to go over a little bit about the difference between SI referred pain or sacroiliac referred pain and sciatica. So sacroiliac referred pain comes from a joint called the sacroiliac joint. It's a connection between the sacrum and the ilium. This joint is naturally supposed to be able to move back and forth. So you have your sacrum, you have the ilium, and the ilium is supposed to be able to rock back and forth on that sacrum. Now, when that joint gets stuck in here, we can get all kinds of interesting pains. A common one is just a localized pain right here, kind of by where that hip bone bump is on your back. That joint, though, as well can send referred pains into the butt cheek. It can send pain down the back of the leg. It can even send sometimes pain up into the lower back. Now, the nice thing is that we can take care of this, we can get it fixed. You just gotta adjust the sacrum and the ilium to get that joint moving again. Once that joint starts moving again, then you're able to get quite a bit of relief. A vast majority of the patients, I would say, get that joint adjusted, see some sort of improvement immediately after the adjustment. Now, sciatica is a little bit different. Sciatica can come from several different causes. It can come from the lumbar region, with the facet joints in the lumbars, which are these little connections here that allow the spine to move. It can come as a result and related to this sacroiliac joint, which we just talked about. And it can also be related to what's called the piriformis muscle, which runs from the sacrum here down onto the hip. So what will happen is the nerves can get irritated along the way down. The biggest thing is that we find is that a lot of times there's a entrapment with the piriformis muscle. The sciatic nerve is a very thick nerve, and it can get trapped underneath that muscle. And if that muscle's spasming due to distortions of the pelvis, things not being aligned right, it'll clamp down on that nerve, and then it'll give you all kinds of pain, numbness, tingling, things of that nature. And the big key factor to being able to tell the difference between SI referral pain and sciatica is going to go from the knee down to about the foot, whereas the SI referral pain is going to go from about the low back down to the knee. And sometimes you have both. Sometimes you'll have SI referral pain and sciatica, and then your whole leg just hurts. But if you are wondering, maybe if you do have sciatica, just know that if it's going from the knee down to the foot, there's a good chance you are. If you're having pain more in the lower back, going down the leg, stopping above the knee, you're probably likely having sacroiliac joint pain. Either way, we're going to be able to help you. Get in, let's take a look at you, make sure there's not something else bigger going on. We're excited to take care of you. Have yourself a great day.